Thank you for viewing this video brought to you by PCE's National Best Practices Committee and sponsored by the Carpel Foundation. The following presentation by prosecuting attorney Jean Peters Baker from Jackson County, Missouri, explores the role of the modern prosecutor.
My name is Jean, and I've been in the top role of the prosecuting attorney's office here for over the past 10 years. I don't know, maybe it's like 12 years now. And then I started in the mid to late 90s as an assistant prosecutor, and largely this has been my home since that time. And one of the things that sort of demonstrates what's very, very different is that as I talk to you, I'm at my standing desk. There was not a standing desk when I started in the office years ago. That wasn't a thing, really. We didn't talk about that. Now we talk a lot about, standing desk and sort of the overall welfare of prosecutors, how we can better serve them, their mental health, as well as training them on, a whole gamut of other issues. But I bring that up because it's a pretty stark change than when I first started. It's not as if this job was not incredibly hard all those years ago and very, traumatic all those years ago to see the types of things that we do, but I don't remember ever talking about it. I don't remember ever anyone thinking it was something to talk about. And so we now spend a fair amount of time talking about it and talking about the wellness of prosecutors and how to keep our mental health in good check. I'm not sure we have a lot of answers about that yet, but at least we're trying to address it. Another thing that has changed so greatly is that from when I started to now is the sort of black box description of a prosecutor's office. We really were a black box. We didn't think that because maybe we put out a press release from time to time about, how a sentencing went or whether or not we charged a case or not. But we did not really track data. We didn't capture our data in a way that we could really track it with any real good sense of what we were actually doing. And so therefore we didn't study anybody's data, our own, the police, anyone's. And so that is something that we've taken a very sharp turn on. In fact, we've gone from the black box to having a couple of different dashboards that are, populated from my office 24/7. And it's available for people to look at and judge how I'm doing at any time, that they want to take a look. Other topics that we've done quite differently is as prosecutors is now I study clearance rates. It's unfortunate that sometimes police look at that as a critique of them. But if you don't study clearance rates, you cannot literally make them better. You can't sort of address how to improve. And so not only do I study the clearance rates of homicides, which are, the most interesting for most members of the public, but I really study non-fatal shootings and how many I have in my jurisdiction, how many are we prosecuting, what are my outcomes on those I prosecute. And from really digging into that kind of data, I learned just how pitiful the whole system is at addressing non-fatal shootings. And to give you a sense of that, because I do track my data and study it, I have well over 600 non-fatal shootings in just one piece of my jurisdiction annually. And of those, about 600 or so individuals that have a bullet that actually strikes skin, but they survive. Only about, I'll be encouraging and say about 15% of those 600 cases make it to my office. I don't file for that full 15%. Now that drops down to much closer to 10%, sometimes even down to 9% of what I will actually file. So that is a whole lot of people in my jurisdiction that have been harmed, have no chance of getting any justice through this system, and that are just sort of left to their own devices to kind of figure out how do they heal from that, what can they do. And so I have set up some other programming through a tax that is available in my jurisdiction for public safety and treatment of certain types of harm in the community. We have worked on trying to address the trauma that those individuals face from being shot, the retaliation that often occurs from those cases. And we've kind of leaned into those people from a different perspective than the prosecutor and the police chief. But generally, as just citizens who care about these people and the harm that's been done to them. But I would not have known that without really digging into clearance rates and digging into how we're all faring through the criminal justice system on those cases. So those are sort of the very big things. There are others that are probably obvious to people, that when I came here in the 90s, we were really still really fighting the war on drugs in a really concerted way. We all knew we were losing. We all, I remember coming into that unit as a young prosecutor, we all kind of laughed about it because we knew how foolish it was. Even by the late 90s, we knew we had lost, but we kept fighting it. And so it took me digging into my data again, seeing how actually very, very poorly we were handling drug cases. And that I was encouraged to do that after a pandemic hit. And I need to look at what else could I shift? What else could I put my time on instead of drug cases? So that data taught me that our dismissal rate of cases that we did file was ridiculously high. It was embarrassing, to be blunt. The racial disparities in those cases was beyond anything that I ever imagined it would be. It was so high, it really struck me right in the gut. And, and that taught me some other things about how we might be able to do this more effective outside of the criminal justice process rather than inside of it. So I think my job has really kind of shifted to be, what other systems can I use? Not just the criminal justice system. What else might I be able to use in order to serve my community better? How can I help them? How can I actually get them service if the criminal justice system cannot do it? And so I've become much more multifaceted, I guess I would say, in how I look at crime and who might be able to solve it, what system might be able to step in to care for my community. So I think those are the highlights.
Can you talk a little bit about your the intersection of your crime strategy unit and your community advisory board?
Yeah. So all good ideas are stolen, I think, from other people. So Jeff, I stole your ideas, and I'm not gonna I'm not gonna not confess that here. I noticed that, I had a need to kind of have a better system of getting advice, and where else could I go to kind of get a sounding board for policies that I wanted to run and help shape those. And so I put together something that I stole from Jeff Reisig, and that was a community advisory board. And it was a group of people that are not friendly to me. It is people that actually speak pretty ill of me most days of the week. I wanted some of them to be on a board. I wanted it to be very multidisciplinary, so that I wasn't just putting an activist on a board, but I was putting an activist and a police officer and an academic and, as many, someone from the business community, as many different voices as I could around a table so that they could help me solve problems. And that has been really critical for me in shaping policy and carrying out policy in a way that I think is responsible to my community and public safety. And then the other thing that Chris mentioned is a crime strategies unit. And it seemed natural when you start really looking at crime and you're trying to understand why crime occurs and why certain communities are so much more vulnerable than other communities to crime. What else should we be doing? And so I hired a crime analyst for my office. Admittedly, this is one of the hardest decisions that I made, was to take money and give to a crime analyst, knowing they couldn't carry case files into a courtroom and prosecute. So it was really a hard decision to make. And it's been one of the best decisions that I made, is to spend some money in that area, because they helped show me what my data means. They helped me understand my own data. They helped me, pull that data out of the system. And I absolutely needed that. I can't lean on assistant prosecutors to do all things. Sometimes you have to go to someone who actually has that area of expertise and help them help you run your office. So that's why I have a crime strategies unit.
And last question, and then I'll open it up to other people asking you questions. You had mentioned leaning into these non-fatal shootings and using a local tax for something. What did you use it for? What did you do with that funding?
So I figured out where my non-fatal shooting victims were going for treatment, where they were going to get their wounds literally sewn up. So I know what hospitals they go to. I know how many people receive treatment at those hospitals. And then I went to those hospitals with my local university, and we came up with a program that I fund through this tax. But it is, as they're getting their wounds sewn up, they're also getting trauma treatment. It's not just, any trauma treatment. This is the kind of acute trauma that they are in at the time, a bullet might strike skin. All that level of trauma is different, than maybe other types of trauma, or trauma that will spill out for them over time. So we got real experts to the table to help put a program together. I didn't know how this would work and how this program would actually, if it would be successful at all, because what I know about my non-fatal shooting victims, it's usually closer to about 12% are willing to speak to the police about who shot them and give them sort of fulsome information about that. So if that number was so low with police, I figured it's going to be pretty low when they encounter someone offering them trauma treatment. But the reverse has been true. About 76 to 78% of those individuals accept that treatment for mental health while they're at the hospital and thereafter. So that taught me something. That is that the criminal justice system, we have a gap of trust, and for whatever the reason, I don't have to ascribe a reason for that at this moment. It's just a gap of trust. When the same afternoon they tell a detective, no thanks, I don't want to talk to you, or I don't know anything. And then they turn to another professional that they don't know and they say, yes, I will accept some trauma treatment. And then we also offer them case management thereafter, so that we can help solve some of the other problems that happens to non-fatal shooting victims, because real things happen, like they lose their job, they have new medical needs, maybe they're not safe in their home, maybe their kids are not safe in that home, they've lost income. So we really do try and find a way to meet some of those needs. So we literally provide a commode if that's what someone needs in their home when they leave the hospital, or we maybe provide some kind of utility assistance until they can get back on their feet. So we really try to help them meet whatever needs that they have.
So this is not the traditional role of a prosecutor. You're working on cases that there's no arrest, there's no case, there's no courtroom proceedings. So how does that fit into your thoughts about what your job is?
Well, there's going to be a lot of opinions about this. And when you have the standing desk in my office, you get to be the one who decides. So what I decided was, I didn't really care if people felt like this is not the role of the prosecutor. The prosecutor didn't have any business here. I saw a need in my community and I wanted to fill it. And I did. I know that I have other experts in my community that if I just brought them together, that they would help me serve these people in a different way than they were being helped before. So I see my role a little bit as a convener, the person that also has to oversee this tax. I also have the ability to kind of help shape a program and then help fund it. because some of this stuff costs money, a lot of money. And so I use those roles and intersect them together so I can better serve someone, because when someone is shot in my community and there is not a police response or a prosecution response or a criminal justice system response, somebody better step in. Somebody better step in and offer them something that helps solve some of their problems, that helps take care of them and care for them. And so one of the things I profess is, if we want to live in a healthy community, we have to demonstrate what a healthy community looks like. And a healthy community does not allow a non-fatal shooting victim to just suffer on their own and figure it out. That we come in and try and offer assistance.